he pops on, we will just start to, we'll just incorporate him at that point. But if not, Quincy, you might be the star of the show, my man.
Okay.
If that's okay.
Yeah, sure.
Okay. Well, if everybody we'll certainly show us video. If everybody is ready, I guess we can get going. Okay. Hello, everybody. Welcome to the fourth and final session of the Career Cafe. I am Josh Sloan, your host. I am also the volunteer and outreach coordinator with Sportable. We are a local nonprofit in Richmond who provides sports to people with physical disabilities and visual impairments. You can learn all about that at sportable.org if you're interested. Stay tuned until the very end of this session, because that is when we will be raffling off a gift card for one lucky attendee. So if you want a chance at getting some free stuff, you got to stay till the very end. The Career Cafe is produced by the Department of Aging and Rehabilitative Services, DARS, and Virginia Ability in support of National Job Shadow Month 2021, which is wrapping up here in a couple days. The goal is to help students explore career options and opportunities in the state of Virginia. And today's segment will feature at least one guest interviewer, possibly two. I will be interviewing Quincy Jones from HCA Healthcare, and he will be talking about the field of medical coding, which is not medical billing, which is something I learned about 5 minutes ago. There is a chance that Gerald Ford from the Pittsylvania County Sheriff's Department will be able to hop on the call to talk about careers in law enforcement. Due to the nature of his job as a first responder, he is predisposed with some sort of emergency that is outside of our control and outside of his control. So he has been contacted, and if he is able to make it in any way, he will, and he will join the conversation then. But for now, we are going to focus on Quincy because Quincy is here and available. So today's format is as follows. Following my interview questions, we will open the chat for Q&A from viewers. When the question and answer period is open, to ask a question, you can just type it into the chat box. We might not be able to get to every single question, but if there are pertinent questions that we were not able to answer, we can provide answers to those by email a few days following the interview. I think that is it. The first thing we are going to do, we do have a really nice video from the Sheriff's Department that was provided. So we are going to check that out for a couple of minutes, and then I will go into interviewing our guest Quincy Jones from HCA Healthcare. So Nate, if you want to cue up the video, I think we are ready for that.
Imagine a world in which criminals are never locked away, where courtrooms sit empty with no justice being served, where divorced fathers are not made to support their children, where schools are left unprotected, and where 911 calls never get answered. That's the world we'd live in without sheriffs and their deputies. But thankfully, there are thousands of brave men and women across Virginia who dedicate their lives to protecting our communities and our way of life. Across Virginia, there's a whole world that exists that most people seldom see or even think about. Our jails house almost 30,000 inmates daily. Hundreds of felony arrests are made every day. Our courtrooms work to deliver justice. Crimes are investigated and sometimes prevented. If it weren't for Virginia sheriffs and their deputies, all of this would come to a dangerous halt. The sheriff is the only locally elected law enforcement officer in the Commonwealth. So sheriffs truly work for the people, have a vested interest in the community, and are directly accountable to its citizens. Also, a majority of Virginia counties have no police force. In those localities, sheriffs are the primary form of law enforcement. Deputies also respond to potential crime scenes, preserving and collecting forensic evidence such as prints and DNA samples that can make a case for arrest and prosecution. Deputies are in our schools too, protecting our children, as well as teaching drug prevention through the DARE program and gang resistance education through the GREAT program. Sheriffs also run services for crime victims, as well as protecting witnesses of crimes. Sheriffs offer the VINE program, allowing victims of domestic violence to track their assailant through the system. So whether you're aware of it or not, protection is all around you, and they wear the uniforms of sheriffs and deputies all across Virginia.
Right. As I said, there is a distinct chance that we may hear from Gerald from the Sheriff's Department, but we are not going to hold our breath. So Quincy,
Yes.
I am going to go ahead and get started with you, sir. As I said, Quincy is with HCA Healthcare, and he works in the field of medical coding. Quincy, could you just kind of give us a brief overview of your business and the overarching stuff?
Okay. So my name is
All right.
Quincy Choice. I've been with HCA, which is Healthcare Corporation of America, and we are the largest healthcare corporation in the country. We own about 250 hospitals in this country and 2 in Europe, and we employ about 300,000 people nationwide. So I'm in the Capital Division, which consists of Virginia, New Hampshire, Indiana, and Kentucky. And my division, we probably employ about 32,000 people. And in Richmond, we employ about 13,000 people. And so, like I said, I am the director of revenue integrity for the division. And so my focus is making sure that the doctors are billing correctly and that what they bill is sent to the insurance companies correctly, meaning that every time you see a doctor, he has 2 components that have to be done in order for that claim to be billed, meaning he has to give you a diagnosis code and he has to give you a procedure code. So every time that you go into the hospital or to a doctor's office, that doctor will assign, say that you have the flu.
Mhm.
When you have a certain situation like that, you notice that the doctors always take notes and they're always writing things. But if you've ever seen a doctor's handwriting, you
Not
can't
so good.
you can't read it. So in order to avoid that, the American Medical Association decided to incorporate codes for everything that a doctor does. So if you have the flu, it is assigned a specific code. If he takes your temperature, it has a certain procedure code. If you're a surgeon and you're doing a bypass, there are lists of certain codes that he's performing. For every time that he makes an incision, a code is assigned to that. So that if someone else is reading the doctor's notes, they don't have to worry about his handwriting because everything has an alphanumeric code to it. And so in my department, one of my departments, I'm in charge of the coders for the division, which currently I have 72 coders within my division, which all they do is they read doctors' notes and assign codes so the codes can be billed to the insurance companies. So in order to be a coder, that's a process in which you have to study for, and you have to take a certification test. And once you take that certification test, your basic primary test, you're able to actually go out in any medical field and actually code for a physician or a hospital. So that's what I've been doing for the past, I guess, 7 years as a coder and a coding director. And I've been with HCA for 21 years.
Wow. What was your position before taking on the director position?
I was actually the collections manager for the division. So when you bill a claim, it goes to the insurance companies. And so my team was responsible for making sure the insurance companies actually pay the claims. So we
Oh,
make sure that, if a claim gets rejected, we have to go back and work with the insurance company or the doctor to make sure that things are corrected so that the claim can bill and get paid. And just actually staying on top of the insurance companies to make sure they actually pay the claims and pay them properly.
understood. Um, just curious,
Mhm.
how long is one of these codes? Like, how many letters and numbers is one code?
So for a diagnosis code, it can be anywhere from 3 digits, like it can be 1 alphanumeric digit and 3 actual numeric digits, or it can be, depending on the specificity, it can be up to 7 digits for a diagnosis code. For a
Huh.
procedure code, it can be between 5 and 7 digits for procedure code as well. So
Could be worse, I guess.
yeah, it could be worse.
Well, what positions does HCA typically hire for within the coding division?
Yeah.
I think what was it?
So we have a coding department, but it's called our operations department, meaning that it's coding, it's customer service, it's billing and collections, all kind of combined into one department. And so, like I said, mentioned further, when I first started with HCA, I came in as a collections person, meaning that I would call the insurance companies, make sure they paid the claims. And then I got promoted to actually a collections manager. And then I worked with the billing department. So billing, this is the coding, but let me just start over. This is the coding manual that everyone has to use. It's pretty thick.
Yeah.
So
Walk in the park, that book.
yeah,
huh?
walk in the park. So could you guess how many classified diagnosis codes that we are able to bill in the United States?
So let's put that in the chat. Y'all attendees, put a number in the chat.
So these, I'm trying to separate it here. I'm not sure you can see this. This
We
portion
can
right
see it.
here these are all diagnosis codes that you could possibly use. This thicker section right here are all the procedure codes that you could use as a medical provider or a dentist or anything like an optometrist, anything like that. They all use the same book. So guess how many diagnosis codes there are.
We've got a ton of guesses coming in.
Okay.
We'll do prices right rules, so you can't
Okay.
go over. We've got 4 million, 40,000, 800, 7,000, 100 million, 70,000, 23,417. I do appreciate the specificity. 50,000, 9,000, 30,000.
Whoever said 70,000 is correct. It's 69
Whoa!
diagnosis codes that a provider could possibly bill for.
Wow.
70,000. And so procedure codes. So if you think about anytime you go into the doctor and they're taking your temperature, you get stitches, you have an operation, how many procedures do you think that we could bill for in this country?
No clue.
That's 75,000 procedures that you can bill for.
Wow.
And so that's a lot. So when you're a coder, of course, you're not expected to know all 70,000 diagnosis codes and 70,000 procedure codes. And that's why you have to have a lot of training to do this. And so there are very, very vast sources of training to be a certified professional coder. There's some classes that they can train you in 3 days. And you're supposed to take the test. And if you pass the test, you're a certified coder. I do not know anyone who has taken the 3-day course who has actually passed the coding exam because it's just so much information. It can go up to 2 years to be a coder. If you go to one of the professional junior colleges like John Tyler, Richard Bland, they have coding courses as well, but that's a 2-year program. I personally went to a private coding company here in Richmond, and my class was about 9 months, and we met once a week for like 3 hours. And
Is that company still around? Do you
yes,
know
it's called Practice Integrity.
Okay.
I would say that is probably the most comprehensive coding class out there. Their success rate in passing the exam for the first time is like 90%. They're very
Wow.
hands-on. You get practice tests, and when you take their course, they give you the coding manuals. You get as many practice tests as you want, and it pays for your actual exam, which is actually $300. And it pays for your membership in the AAPC, which is American Academy of Professional Coders, for a year. And you kind of have to belong to that in order to get your certification.
Let me ask you, so with that company as well, is there access to job opportunities once you complete?
Most certainly. So they help you find jobs, but actually it's kind of funny when you mentioned that. I went on Indeed yesterday morning to see how many coding jobs they had listed for just the city of Richmond. And yesterday morning, there were 34 coding opportunities for someone looking for coders in the city of Richmond alone.
That's great.
And so when I say coding, that can be a number of things too. Like insurance companies use coders as well to audit what the doctors are sending in to you to make sure they're coding correctly. You can code for a specific doctor. You can code for a hospital group. You can code at home. You can work for a company that, you know, you have to actually go to the doctor's office and code it as well. So coding jobs are very vast because if you think about it, the physicians, the nurses, the dentists, they don't want to look through this entire book to figure out the proper code to use to bill. They
Sure.
just want to take the notes and see the next patient. And that's what they're there for. They're there to see patients. So that coder's responsibility is to interpret the notes and code so that the claim can be billed for the physician and paid promptly.
Gotcha. So outside of coding, it's obviously a very high demand job, as you just said. Are there other within your department? Are there the other positions, like entry level positions, typically have a lot of openings, or those fields as well?
Yes. So of course our customer service they're always looking for customer service people. I did not look at to see how many openings we have currently, but we're always looking for customer service people and collections. And like I said before, when you say collections, most people think that you're calling patients or calling people and asking for money. And some people don't have the personality to do that. And personally, I wouldn't want to do that.
Doesn't sound fun.
But when you're calling insurance companies, it's their job to pay the claims. And so it's not personal. You're calling the insurance company and say, okay, you know what, you've had this claim for 14 days. You've had this claim for 2 months. Is there anything wrong with it? And you're just asking, when can I expect payment? There are always openings for collections in the collections department. And now, due to COVID, all of that's done at home. So you log onto your computer at home and you're calling the insurance companies or you're emailing the insurance companies to get that information to see when the claim is going to pay, or if there are any issues that you have to modify that claim to get it to pay.
So I'm going to just kind of do this one by one. What kind of background in terms of education or skills and knowledge would you need to apply or be a good candidate for the customer service division?
Customer service, you have to have a friendly disposition. And if you think about it, during customer service in healthcare, most of the people that are calling you or contacting you, they're not in their best disposition. I mean, they're upset, they're hurting or whatever. So you have to be kind to your patients. That's what we always have to say. You have to have a high school education. Other than that, we're willing to take people straight out of high school with no experience. And there's a training course. A training course is probably about 3 weeks, but it's paid. And you're basically sitting in a classroom, learning the computer system, knowing what to say to patients, knowing how to operate within HCA's world. And so, yeah, we take people with no experience. Yeah, we definitely take
That's great.
Experience.
So same question for the collections department.
Collections department, they typically want someone with collections experience, but that's not a necessity. Myself, my background is in biology and biochemistry. I had no inkling about collections. To be honest with you, I was working in a laboratory in Northern Virginia and was tired of being in the laboratory for 8, 9 hours a day. I wanted to try something new, and someone took a chance. And I had no experience in collections or anything like that. And I ended up being a collector, and I just moved my way up the company. So they will train you. The HCA will definitely train you to be a collector or customer service representative. And again,
So
it is an intensive, you're in a class for 3 weeks. You don't even see anybody else. You're in class for 3 weeks before you're actually allowed to actually get on the phones or your computer.
Sure. And so for the collections department, there isn't necessarily 2-year degrees to be seeking or 9-month training courses like you mentioned for the coding.
No, not at all. You have to have a high school diploma.
High school diploma. Got it.
Diploma.
Great. Okay. Well, I think we've covered a lot of the entry level stuff for coding. Is there a like a 4-year university path into coding as well, or?
They're not necessarily. To be a coder, you have to, your basic requirement is passing that certification exam, which is 5 hours and 40 minutes. It's 150 questions. It takes 5 hours, and well, you're allowed 5 hours and 40 minutes, and you'll use every every minute of that time.
Oh my gosh, that sounds terrible.
It's intense, but they
Yeah.
prep you for it. I mean, you have a lot of prep courses, and it consists of medical terminology, um, billing, and just governmental rules on how you can bill a claim. And so it's not all just interpretation of a doctor's notes, but I guess about 70% of it is looking at a doctor's notes.
Gotcha. So to the best of your knowledge, what are the entry pay rates for
Okay.
the three groups we've been talking about?
So for a coder, coders are in very high demand. So the pay range for a coder, starting off, it's about $35,000. But you're more
Nice.
but you're more advanced, the more opportunities you get and more experience you get, you can take additional certifications. Like if you just want to code surgeries only, those are very complicated because there are a lot of procedures that are going on. Those pay a little bit more. So the range for a coder is anywhere between 35 and about $75,000. When you get to your $75,000, you're basically doing auditing. So you're auditing a physician to make sure that they're coding correctly, or you're auditing a medical group to make sure they're coding correctly. But the average pay for a coder with about a year's experience, I looked this up yesterday, is about $45,000, which is pretty good.
45.
Yeah,
No, that's a great living. Yeah, absolutely.
yeah.
How about for the collections department? Do you know roughly? I mean, if not, it's totally okay.
So the average for a collector with HCA is about
Mhm.
$38,000. So they're starting off
Okay.
about $38,000, and the same with customer service as well.
Wow, that's great. Okay, let's see. At HCA, what are you looking for when you're hiring an employee? Um, like we've kind of talked about more certifications and things of that nature, but what else?
You have to be a person who wants to help people, because that's what you're there for, and you're helping people who need help, or they need people to take that time to pay attention. I mean, all of us have felt bad at one point, and you come across the wrong person, that can ruin your day. Well, when in healthcare, most of the time that you're encountering someone, it's not their best day. And so you want someone who is professional, um, who is who has empathy, who's going to go that extra mile for that patient, even if they're calling about a bill. It's that's very important to them, or they're nervous, or they're upset because the bill is too high. You want someone who is very professional, who just enjoys being around people and working with people.
Sure.
Mhm.
Yeah, I know I've called a billing department upset and not happy about a bill for sure. And yeah,
Yeah,
it makes all the difference if that person can stay calm and be helpful and have that pleasant disposition that you're talking about.
that's true. That's true.
Let's see. Does HCA hire students for internships or apprenticeships or other things of that nature?
We don't in the business office. That's more of your clinical experience. So if you're saying in nursing school or want to be a physical trainer, we do have internships in those areas, more of your clinical when you're actually working with patients. But in your business office, we don't usually have internships, unfortunately.
Gotcha. That's totally understandable. Totally understandable. Um, let's see. We've talked about this a little bit already, but within like your current role, how did you find yourself there from, again, like you said, you were in biomedical research, and then you started in collections. How did you find your way up the ladder, so to speak, at
To be
HCA?
honest, I just really enjoyed my job, and I just wanted to learn as much as possible. So like my first day there, I knew nothing about collections, but I mastered that. I enjoyed that. And I started watching people in the billing department, what they were doing, and just working and talking to people. I was given the opportunities to work in that department. And then in the coding department, I was wondering how these, how bills are actually made. And so where are these what do all these numbers and letters mean? And I just took it upon myself to enroll myself in a coding class. And that opened up so many more doors that
Mhm.
you can actually talk to physicians about their practice. If you're the way medicine is now, it's more of a value-based system. Meaning that when you go to the doctor, you've been to the doctor recently, they're going to ask you, are you having any trouble breathing? How's your psychological health? Meaning, are you depressed and things like that? There's a reason why they're doing that is because those are requirements now in order to see a patient. And so you have to bill for that and you have to code for that. And so when a doctor is coming in and they say, Quincy, my reimbursement is pretty low, I can look at the claim or look at their notes and say, well, you're not asking the patient, you know, any psychological questions. You're not asking them about, weight loss if they're obese. You're not asking about their blood pressure. And you can have that correspondence with a physician and you can speak in their terms and you can teach them. So if you're doing this, it's a different code that you would use that you're currently using. You can use a different code that actually is more reimbursement or describes the situation a lot better.
Very cool. And within HCA and I think really within the medical sort of like the office side of medical things in
Mhm.
general, um, are there opportunities that would befit someone with a disability, whether it's
Oh yeah.
physical disability or intellectual disability? Because that is kind of the focus of why we're here.
Yeah, most certainly. So on my team, when I was a collections manager, I had 30 people on my team at one point, and three of them had disabilities, cerebral palsy, actually. It When you're on the phone and you're working with people, it's fine. That's not an issue. In the hospitals and customer service, if you notice that there are people at the front desk to help you get around, we hire people with disabilities all the time in HCA. So it's not a limiting factor. Um, in fact, I talked to my HR vice president this morning about that specifically. And of course, there's definitely no discrimination about anything like that. And we encourage that. We want the diversity because, you know, a person with disability may have a different viewpoint on how patients should be treated. They may have experienced something that a person without a disability has not. So that empathy level is different, how they interact with patients. And so, yes, for HCA, we definitely encourage that.
I can certainly speak to what you just mentioned, and that I spent the vast majority of my life able-bodied and have been disabled for about almost 7 years, and yeah, you learn a whole lot about doctors and
Mhm.
the ups and downs and insurance and all of those things, just living with a disability, particularly one I think that you acquire. So yeah, I could definitely see it as being a a boon to the empathy that is helpful in the fields that we're talking about.
Right. And another thing, too, like I said, during with COVID, is a lot of these jobs are work from home. And so you don't have to be in a hospital. And with coding specifically in billing, certain companies and certain practices, you can make your own hours. So if you have, if you have to go to physical therapy, you have doctor's appointments during the day.
Sure.
Um, I know one of my coders, she prefers to work from 3 in the evening to 11 at night. And it doesn't, I mean, for a coder, you're not really contacting anybody. You're reviewing notes and coding claims. And so it gives you some flexibility as to your work environment and your work hours. Now, of course, for customer service, you have to be there when the patients are there. So that's usually a 9 to 5 type job.
Sure.
Um, Billing, again, the same thing with billing. When you're looking at a claim and making sure that everything on that claim is correct to send to an insurance company, that doesn't require a 9 to 5 work hour. So
Sure.
so a lot of these you kind of make up, as long as you're getting your, like I tell
Work done.
my employees, as long as you're getting your work done, you're getting your at least 40 hours in. If you're a full-time employee, do it whenever is best for you.
That's great. It's appealing to me personally. I can tell.
And
Uh,
we have a lot of single parents, and with COVID, during the day you have to help the kids with their, with the school.
sure.
Of job flexibility like that is really valuable.
Absolutely.
And so while you're a teacher from 8 to 2, then you can actually work from the rest of the day.
Well, let me ask you another question. What single piece of advice would you give to someone looking to find a job in one of these fields?
Um, Take the initiative. If you want to do well at any type of job, do your best, be as professional as you can, and take the initiative. By doing that, at least I can say my experience with HCA, it's almost limitless. I mean, I had no experience in healthcare. I mean, I was in a laboratory, like I said, for 8, 9 hours a day. And I took the initiative to learn other things. Um, if any projects would come up, I wasn't afraid to try it. If I failed, okay, at least I learned something from that. And people notice that. I mean, my top employees go above and beyond every day and they're rewarded for it.
Sure.
They're either team leads or managers, or their bonuses. If they're going above and beyond, you can earn bonuses. And so, yeah, always take the initiative, do your job well, but go above and beyond, and it will pay off.
Absolutely.
Yeah.
Okay, we have a ton of questions coming in, and to be honest, the past three of these career cafes, it was hard to get to all of them, and I think we actually have time to
Okay.
today, which is great. So starting from the top, do you need a specific background to be a coder?
You do not. You just, like I said, you have to take the course and pass the exam. Um, and like I said, it is intense. It's a lot of work.
Sure.
And the exam is not, like I said, it's almost 6 hours long. But once you get that certification, you can code. And then after you get that certification, you can specialize if you want to do optometry, coding for eye disease. If you want to code for cancers, that's a different test that you would have to take.
Mhm.
But each certification that you get, your marketability
Goes
and
up.
goes up, and that means more money, a higher salary.
And we mentioned very briefly some 2-year programs that fit this bill. Do you know where they offer those and like specifically what they're called or?
So Brian Stratton, J. Sargent Reynolds, and University of Richmond all have coding programs. And what they do specifically, you'll take a semester of anatomy. So you're going to learn all the bones in the body, you're going to learn your nervous system, things like that. Then you're going to take another class of medical terminology. So when a doctor is speaking all these, 15-letter words, you know exactly what they're saying. And so with coding, that is probably what you're studying the most, is when a doctor is writing something, you know what um, system they're referring to, whether it's respiratory, cardiology, you know what system they're referring to. And so for your first year, you're doing medical terminology and anatomy and
Okay.
physiology. And then the second year that you're doing that is actually learning coding itself, how to look up a code, what it means, what sequence of a code that you have to use, of diagnosis codes. And so for that, it's a I guess a more intense, drawn out program, but it's more robust. Or like I said, for the one I did, Practice Integrity, it's a 9-month course in which you're meeting once a week for 3 hours, and they give you a lot of homework between the
Yeah.
sessions, but it's more focused on coding specifically. We go over anatomy and medical terminology, of course, but you're focusing on the coding portion of the job.
Now, another question that popped up that we've kind of covered, but I think we can expand on a little bit.
Mhm.
Do I need a college degree? The basic answer is no, but would you say it's helpful, or
It helped me because I was a biology major and my master's is in biochemistry. And so the medical terminology and physiology, that was a breeze for me because I studied it for 7 years, but it's not a necessity. No. Of a college degree, college background is not a necessity.
that's great. I think with so many fields these days it is. So that's
Yeah.
awesome that it's not.
No one, if
Um,
you're applying to be a coder, no one's going to ask you if you have a bachelor's or associate's degree.
and we covered the pay. It starts around 35 and
Mhm.
goes up from there.
Yep, to about 75.
What HCA hospitals in the greater Richmond area, or actually, you know what? If you know all the ones in Virginia, there are folks from all over the state here. What hospitals in Virginia are HCA hospitals?
Okay, so in Southwest Virginia, in the Roanoke area, we have Lewis Gale Medical Center, we have Montgomery Medical Center, and Pulaski Medical Center. In Richmond area, we have John Randolph, which is in Hopewell, Virginia, Chippenham, which is in Chesterfield, Johnston Willis, which is in Chesterfield, and you have Henrico Doctors Hospital as well. So that's all in Virginia. Then we have 2 hospitals in Indiana, Kentucky, and 3 hospitals in New Hampshire for HCA.
Gotcha. I was actually born at Chippenham.
All right, okay.
What are some of the perks of a coding job? Like, what's some benefits that are unique to coding?
Well, I will say, like we just spoke about, is your work-life balance. So even if you're not working for HCA, majority of if you're coding for a doctor or any other hospital company or a coding company, they worry about quota and getting the claims out as quickly as possible. So like I said, it's not a 9 to 5 job if you don't want it to be. You kind of make your own schedule with that, which I think that's a very good perk. Is that
Yeah, you've kind of sold me on it.
yeah, you can. And you know what we also have too is that we have people who work a full-time job doing something else and do coding part-time on weekends. So, it doesn't have to be full-time, and some people don't want to work full-time as a coder. You can pick and choose what hours you want.
Very cool. Very cool. Are these certifications, is the coding certification, is it nationwide? Is it international in any cases?
It's kind of funny you say that. It is nationwide. And we have companies that actually outsource coding to India and other countries, and they have to pass the American portion of the coding test. But if you pass the certification here in Virginia, you can go to Texas, California, Hawaii. It's the same thing. In fact, some of my coders who actually live here in Virginia, they code claims for other states. So they're not coding just for the doctors here in Richmond. They're coding for doctors in Indiana, Kentucky, Missouri. It doesn't matter. It's all the same thing. So yeah, your certification is national.
Very cool.
Mhm.
I have what I think is a great question because it's so specific.
Okay.
I have an associate's degree in HIM and an RHIT and CPCA certification, but no experience in coding yet. And I understand that is a barrier to getting hired. What advice would you give a first-time job seeker? And major shout out to Todd for coming up with such a great question.
Yeah, Todd, that's a good question. So in essence, your certification that you just stated that you are a coding apprentice, which in that scenario, once you pass the certification, you have a year to actually do some coding to get that under your belt. And then you're no longer an apprentice and you're off. Or what you could do if you work with a certified coder who can vouch for your coding abilities, that apprentice label will be taken off of your designation, and you're a full-fledged coder.
Very cool.
Mm-hmm.
Are there cross-training opportunities? Presumably, I think we're talking about like maybe once you're in HCA with one department, is there?
Like I said, you remember we talked about taking the initiative?
Mm-hmm.
Yes. If you are interested in something else, and one thing about HCA is that once you're in HCA, transferring to another department, transferring to another state, is really easy. So you have an inside track. So if you're hired with HCA, say that you're hired in customer service and you take your coding certification and you pass it, and there's a coding job available, you have priority over someone coming from the outside applying for that same position. So say that you and your family are currently in Richmond and you decide you want to move to Florida, and there's an HCA position in Florida and you're already within the system, you get priority over that position over someone in Florida from the outside applying for that same job.
Wow, that's great.
And so mobility is a great thing. Even if you want to cross into different areas, you'd be one of the first ones considered for that other position in another area.
And that's something that I think attendees can consider about working for any larger company with multiple offices and multiple divisions. For almost anything like that, whether it's somewhere like Capital One or HCA or anything in between, before jobs even go public, they are, available to folks that work there in other positions. So you always get first dibs if you're looking to advance. Another question is, and one that I certainly need to know the answer to: how is coding and billing different?
Okay.
Is the training different?
So coding, you are working basically with the physician on what they have done. So you're coding what their procedures and diagnosis codes are. Billing, you're trying to transfer that information to a claim to send to the insurance company. And so there are different rules and regulations for doing that. So when a doctor has finished their medical notes, that doctor walks away. They're not concerned about anything else. A biller will come once it's coded. A biller will come and make sure that everything is right on a claim that is sent to the insurance company, meaning that you have the right medical insurance, that we're billing the right medical insurance. We have the right ID number for that medical insurance card. So you remember, anytime you go to a doctor, they ask for your insurance card. That is for your biller. So your biller is making sure that your name is spelled correctly on that claim, because that will kick it out. Like, my name is Quincy. If they put Quincey, that claim is going to deny. So they make sure that the doctor's name is spelled right. Every doctor has what we call an MPI number. It's like a social security number for doctors. And that biller needs to make sure that number is correct on every claim that goes out the door to the insurance companies, because insurance companies will deny a claim if one thing is wrong. And so coding, they're just getting the information and they're just transferring into a number or a series of numbers. That biller makes sure that everything is correct for that insurance company to pay that claim.
Gotcha.
So it's two different fields, but they work together. And then after that, once the claim is at the insurance company, then your collector comes in there to make sure that the actual claim is actually paid. And so all three of them work together. All three departments work together to make sure that claim is paid.
Gotcha. We had a couple of questions about whether or not you can work from home, and I think we've established that absolutely you can work from home.
Yes.
We have another question that if you don't have any insight into, I might, but I think it's a pretty interesting question, and it's actually about the entrance exam. What if you cannot sit for a solid 6 hours? And I think this would be, as related to a need, like an accessibility need, an accommodation for a disability. Would you be able to take breaks within that, the test?
Yeah, most certainly. So we had one person in my class who she had autism, and she could not sit for a long period of time. And so once you let the academy know, they will actually send a proctor to help you with that test. So if you can't sit for 6 hours, they'll allow you to break that up, but you have to work with the academy, and they do this all the time. So it's not anything they haven't encountered before. They will send a proctor to help you with that test and make sure that during those breaks, you're not, doing something you should, calling somebody to make sure it's okay, what's this diagnosis code? But yeah, they do make those resources available.
Great. Yeah, I mean, if not, that would be pretty massive civil rights violation.
Right, yeah, but that wouldn't be ethical. You're right.
Right. Another question that we had that I think I don't have transportation. Are these classes available virtually? Because these
Mhm.
things you can learn from home.
So there's, for the AACP, there's probably 5 different ways that you can study and get certified. One of them is self-study, meaning that you get the books and you study yourself and you take the exam whenever you feel it's right. Um, there's another program in which you're with a proctor, and so you're studying, but you have access to someone who can actually help you answer the questions, and you literally just do that yourself. There's another program in which, and this is what I kind of did, is that you have specific classes with an instructor. Maybe it's once a week or it's once every 2 weeks, in which an instructor is there and they actually, like you're in class, they're actually going over each topic and each chapter with you. And prior to COVID, there were actually in-person classes. Now, yeah, they're not, of course, they're not doing that right now, but that is an option outside of um, outside of
Outside of
COVID.
COVID.
Right,
Right.
outside of COVID. Yeah.
Um, as there's one question that keeps popping up that I think we should maybe just take a couple seconds to come back to. I know we've discussed it, but um, w- just high level, what exactly is coding? Like, and I know we kind of talked about this, but just to kind of refresh.
Let's put it this way: it's interpreting the doctor's visit in a, just put it in a numerical sequence that everybody can read and everyone can understand. So if every insurance company knows what this code is, if it's say the code is 1234, and that's for your, just say a common code, you don't have to worry about going to the doctor and ask them for their interpretation of it. It's pretty straightforward. If they're putting that code on there, you know what it means. It's simple. There's no interpretation. So basically, what you're doing, you're taking the doctor's visit, you're taking the doctor's notes, and you're just composing that and or translating that into a number or a letter, a series of number of letters that anyone can interpret. So they don't have to go to the doctor's notes to figure out what you did on this day at this time.
Right.
Okay.
And another question. As a coder, or do you typically work independently, or do you work with others? Do you have to contact medical offices?
So you basically work independently. There's certain situations where you have to consult with the doctor to make sure that that you're understanding what they're writing and what they're doing. Um, yeah, so sometimes, yeah, you do have to refer back to that physician. So okay, so what did you mean when you said this procedure? Because they may have misspelled it. It may, some of the procedures sound the same or are related. They may not say that you're doing something on one lung and they didn't specify whether it was left lobe or right lobe. You have to specify exactly what's going on. So you would go back to the physician and say, okay, you didn't tell me which side that you're working on, or whether you're working on both sides of the lungs. And so, but 90% of it is independent. So you don't have to consult with anyone. Once you get the hang of it, yeah, you're not consulting with anyone.
Gotcha.
Mhm.
Well, I think for a lot of folks that could be a very big draw to this.
Yeah.
Is that independence and being
Yes,
able to
sir.
make your own schedule.
Certainly.
I have a question that I think we can kind of expand out a little bit. The question is, are there jobs near Whiteville or Bristol, Virginia? But in addition to that, I guess the question would be, what are the availability of these jobs throughout the state of Virginia? And could say, hypothetically, I lived in Bristol, Virginia, but I wanted to work at the office that you manage. Would that be something that I could do remotely?
Most certainly. Um, I'll put it this way. I have on my current staff, I have 4 people that I have never met. I've seen them on camera. I have never met them in person. They live in New Hampshire. I talk to them every day, but
Mhm.
they're doing things for physicians in Richmond. But they applied for the position and they were the most qualified, and their geographic location really didn't have any bearing on my choosing to hire them. So when you say, are there any jobs in Bristol, Virginia? If the doctor's there, they're probably someone looking for a coder. okay?
Right.
But don't let the geographic location limit to where you're applying, because there are certain coding companies where you're applying, you could be wherever you want to be, working from home, but you're, like I said earlier, you're coding for claims that are all over the country.
Yeah, absolutely.
Yeah.
And we had a question, how are the requirements or certifications for billers different than for coders?
Okay, for billing, there is no certification. It's just experience. You're taught how to do it. So there's no specific certification for billing. It's just a training. And for HCA, it's on the job training. You get paid for it from day one. It's about 3 weeks just to learn, and you're learning the terminology, you're learning the HCA systems, but there's not a specific certification for billing.
Gotcha.
It's just a training and the experience. Mhm.
Very interesting. And that's something, is billing something that you could study in like a 2-year degree type setting?
I've seen courses for billing, medical billing courses, but the thing about it is, I mean, that's, each company has its own way of how they do billing because there's so many different billing systems. And so would I say taking a course in that, it would be beneficial? It only depends on what company and what systems they're using. So HCA uses a specific system called Artiva, and you had to be trained on Artiva on how, where you enter certain demographic information. So most of that is on the job training. And when you work for these larger companies, they do pay for that. And so just, you train for a few weeks and then you're set off to do your own thing.
We are kind of running up on time here. We'll certainly have more time for a couple more questions, but just to kind of wrap everything up, let's hypothetically here, we're a senior in high school.
Mhm.
We're going to graduate. We know we want to get into coding.
Mhm.
Take us through, like you graduate, it's the first thing you do all the way up to getting hired and starting to work. Break that down.
Okay, what I would do first is,
You can. I'm sorry.
I would go to the website, the AAPC website, the American Academy of Professional Coders. That website hosts so much information. It will give you information on what a coding course looks like. It'll give you the different duration of coding courses that you could take. It will give you the option of doing online coding. It will give you the options of taking classes at in your local area. So there's a place where you can go to the AAPC website and say, okay, they'll ask you what state are you in, or what city are you in, if you want to take a coding course, and they will list the certified coding courses that you can take in your area to pass your certification. And if you know a coder, talk to them, because there's so many different avenues of coder. Like at Blue Cross Blue Shield, they hire coders to interpret what's been sent in. HCA, we have to code claims, Bon Secours, MCV, your independent doctors. Everyone has to code. And so if you know a coder, talk to one. And there, like I said, we have local chapters here. There's an association here. And in a chapter meeting, when we're allowed to have them, there were monthly meetings that you would go to, and there'd be 60, 70 people in the Richmond area at any one meeting.
Gotcha.
Different levels of coding. So ask somebody. Like I said, the AAPC website gives you a lot of information. And that's
a great resource. Yeah, absolutely. Let's see. We want to make sure we've got enough time to get the raffle and closing statements and stuff, but we've got a couple questions that I think we've pretty well answered. You can do this job from basically anywhere.
Yep.
I think I wouldn't be telling the folks that you're applying that you want to do it while traveling or stopping at hotels or something. But if they've got reliable internet, I think technically you could.
Exactly. Yeah, you can definitely do that. Yeah, I had one of my employees was on vacation and she didn't want to use her paid time off. And so she was coding claims at night while on vacation. I personally wouldn't do that, but it's an option. Yeah.
Absolutely. And we have linked, thank you, Nate. We have linked the AAPC website in the chat. So go ahead and click on that and check it out. Let's see. Quincy, thank you so much, man. This was absolutely great. And I think it was super informative. We learned a lot. I certainly learned a lot. I feel like every time I interview somebody for one of these panels, I'm like, should I like apply for new jobs? Like, so yeah, I think you've done a great job selling how good of a career this can be. Anything else you want to add before we wrap things up?
Like I said, you asked a question earlier, what's going to get you ahead in this career? And like I said, empathy and taking the initiative. Anything in medical field, if you do that, you'll go a long way.
Absolutely.
Okay.
Absolutely, man. Well, hey, thanks again, Quincy. And we would like to thank everybody who was on the call for, following along and asking tons of great questions. I think it was really great. We got to have a really nice deep dive into what Quincy has to say. And I thought that actually turned out better than if we had two guests, to be completely honest. If you are looking for more information on these careers in billing, you can definitely, coding. You can check out the website in the chat. And for other job and career related stuff, you can check out virginiaability.org. On virginiaability.org, you will also find our Jobs Ability portal, and this portal helps connect individuals with disabilities to jobs using AI technology. So definitely give that a look, and we will also have a resource library with other resources to various things related to employment for folks with disabilities. So check all of that out. And now the moment we've all been waiting for, Kate, do you want to spin the wheel?
I do. Do you guys see the wheel on the screen?
No, not yet.
No.
Not yet.
Not yet. Oh, darn. Okay. Hold on. There. Is it there now?
It's coming. There it goes.
Okay, great. Okay, so here we go. I'm going to spin it. Okay, is Jenkins on the phone, on the call still? If you could go ahead and do a quick shout out under chat that you are here. Anybody see Jenkins? Last name Jenkins.
I don't see them. But there's two phone, it could be a phone person.
Okay. Don't have a way of doing that. I'm going to spin one more time. We should have some music on with these. What about Vaughn? Do you see
Yes.
Vaughn on there?
Yes, Joshua.
All right. Oh, yes.
Yes,
All right.
he's there.
There we go.
Awesome.
Thank you so much.
Great. Well, thank you all so much for attending. Not only this session of the Career Cafe, but the previous ones throughout the month as well. Thank you so much to our interpreters who have spent about an hour a week for the past 4 weeks trying to keep up with me talking way too fast. So thank you so much. And I'm aware of it. I try. And once we get going, I don't know. I got to work on it. I'm sorry, but thank you so much.
But Josh, we can't be remiss and thank you. You have been an excellent facilitator, and
thank you so much.
We have really enjoyed it. You have really helped all of us learn a lot about all these different careers. So thank you so much for your time, Josh.
You're very welcome. I'm happy to do it. Absolutely. And Quincy, once again, man, thank you so much. This was great, super informative. I feel like I am leaving here knowing everything that I need to know about how to get into coding, which is the idea. So nice work.
Very good. Very good.
Thank you.
All right. Well, thanks everybody. That is all for it. We do not have anything coming up next week. This was the last one. So thank you all so much for coming. And yeah.
Thank you.
Goodbye.
Take care. Bye-bye.
Thank you, Quincy. Great information.
Yes,
You're
it
welcome.
was.
Yeah, really, man. That was awesome.
You're welcome. Take
I was
care.
like, I'm gonna have to stretch this out. I gotta.
Yeah, it did go quicker than I thought it would.
No, you're great. You had a lot of information to say. It was perfect.
Worked
No
out perfect.
problem. Y'all did a great job. Quincy, we might have to call on you again.